of the hospitals. So you or Dr. Fauci, can you weigh in on that? Because obviously these people have great intentions, but there's some mixed feedback on whether that's a good idea.
I'm sorry.
Better than nothing? Surgical masks. People are sewing them. So clothing manufacturers, volunteers dropping them off at hospitals. Is that necessary? Is that helpful? Is it something you'd recommend?
Well, I mean, you would only recommend that under desperate situations if you don't have any masks. But what we're seeing now, as you've heard, is a rather significant inflow of masks that are coming in that are going to be available. I mean, obviously, if you don't have a mask and you need a mask and it's appropriate for you to be wear it, you do what you can. But I don't see that now as a necessity, given what's going on right now.
Great. Mr. Vice President?
We'll take a couple more, thanks.
Thank you, Mr. Vice President. We keep hearing reports of competition among states that are trying to buy this necessary equipment on the private market. And the governor of Kentucky said yesterday that his state was in line to buy some equipment, but FEMA came in and purchased it from under them. So he says this is creating a real problem for states because on the one hand, they're being told to get the equipment themselves if they can, but on the other hand, the federal government is buying up the supply chain. So is this a problem that you're hearing about, and what is your advice like Kentucky that are having this issue?
I actually spoke to the governor of Michigan today, Governor Whitmer and I, about just that. And we put our FEMA regional representative right on the case. We want to make sure that we're acquiring every bit as much as we can through FEMA. But as we work with the supply chain, we want to have full coordination with the states and the requests they're making and hospitals that they're making. And we're looking into those matters. But make no mistake about it, this FEMA team at the president's direction is leaning into this effort, leaving no stone unturned, literally searching not just the nation but the world for all these critical supplies. And as the president just reported to you, we're in the process of shipping 9.4 million N95 respirators, 20 million surgical masks, 3.1 million face shields, and the list goes on. And we're going to be shipping those every single day. But as I told Governor Whitmer today, who's leading her state through all of this with great energy, we want to partner with her. We want to partner with every governor and make sure that the left hand knows what the right hand is doing in terms of acquiring resources.
Mr. Vice President, thank you, sir.
Or how about you right here?
Thank you so much.
No, right here.
Thank you. Can I ask the next one?
On the mask question, healthcare workers on the ground still report that there are mask shortages. What timeline do you predict for making sure everyone who needs mask is adequately supplied?
Well, I'm going to let Dr. Birx address that as well, but let me say again, I just received a report. We're going to be detailing it before the end of the week, where we've literally identified significant resources, not just around the country but around the world, of the masks that can be used by healthcare workers. And but as Dr. Birx said, we are focusing those resources in the areas where healthcare workers are most exposed to the prospect of contracting the coronavirus. The president's made it clear from early on, right after seeing the needs of Americans who are struggling with the coronavirus, making sure they have the support that they need on the same level of priority. We want our healthcare workers to have the personal protective equipment to be able to do their job safely, and we're working on that. I will tell you, I spoke about this today to several governors, not only the governor of Michigan, but the governor of Indiana, and President Trump and I couldn't be more grateful. The way governors around the country are joining us in calling on businesses to go back to their warehouses and identify industrial masks, N95 masks, that because of the change that President Trump insisted on in the law, can now be used by hospital workers. And they're perfectly acceptable to protect a healthcare worker from the possibility of a respiratory disease. But we're calling on, and our governors are joining us in calling on every business across America during this time of a great challenge where many businesses are idle. Go back to your storehouses, identify N95 industrial masks. And as I told our governors today, they can call FEMA. They can call the state healthcare services, or they can just load them up on a flatbed and drive them over to their local hospital. And literally, we hear stories in every state in the union of people doing that. And so it's happening all at the same time. And we'll be detailing the progress we're making on masks. Anything further, Deb?
Thank you, Mr. Vice President. I just wanted to add one piece, and this is really a call to every state out there and every county that has been doing community-based testing. The FDA put out new guidance, we talked about it several days ago, that people can do self-testing in the drive-through, where you give them the materials to do it in their car, and you pick it up in a biohazard bag. This would free up all of that PPE that you see being utilized in those drive-throughs back to the hospitals and back to the clinics that need it the most. We have to move to the new technology. FDA worked tirelessly to get that out there so that it could be sparing of gowns and gloves and full respiratory N95s. This is the moment to move to that self-testing front of nose with the new applicators that can be utilized so that every single bit of the N95s can be put into the hospitals that need it.
Dr. Burks?
Mr. Vice
Dr. Vice President?
Last question.
Let me just say we look forward to seeing you all tomorrow. We'll be back here with further progress and news. But if I could just say to every American,
Is he okay? He keeps asking.
we'll get through this.
He keeps asking you if you're okay.
We'll get through this. But we'll get through this together. Every American needs to understand that whether you are in an area that's impacted by the coronavirus or an area where there's very few cases, if you do your part to put into practice 15 days to slow the spread, you will do just that. You'll impact the spread of this coronavirus epidemic in our country. These experts tell me that we can significantly reduce the number of Americans that would be exposed to the coronavirus as every American continues to put these guidelines into practice. And we just know that with all of the extraordinary effort that's being done at the federal level by this tremendous team and all of our agencies, all the great leadership by governors in both parties across the country, with all the incredible and courageous work by healthcare workers, with the cooperation and the prayers of the American people, we will get this done. We will not only slow the spread, we'll protect the vulnerable, and we'll heal our land. Thank you all. We'll see you tomorrow.